All right. Yeah, so my name is Petra Klinge. I'm also part of the neurosurgery team here at Rhode Island. And, I'm so blessed to have Dr. Zvokos and Dr. Sullivan as my partners. And yeah, so we always say we are the team for life because we treat both pediatric and adult patients with the same conditions. So, I'm going to talk about updates of our research that we're doing in and around Chiari. And I've always been very interested in cognition associated with spinal fluid disorders. And that started very early in my residency. And so it was a short stretch to also look at cognitive problems in Chiari. And as you know, this is a very emerging field. And then adding to Dr. Sullivan's talk, I will talk about our recent research efforts to look at ligamentous regulation of the spinal fluid flow and the skull base integrity as it pertains to Chiari. I'd like to disclose our collaborations and also our support, which includes Bobby Jones, and we thank you for that and for your ongoing interest into our research endeavors. Um, so let's talk about the cognition. So when we look at cognition, we spread it out into certain domains, meaning like certain characteristic of our cognitive function. And that's basically the language that neuropsychologists use when they look at cognition. And a lot of studies have been done in Chiari. You'd be surprised in the past 2 to 3 decades. And it's been found that mainly, like executive function, like how you execute tasks, immediate recall, like immediate memory or learning of information, and also visuospatial skills, meaning how you visualize things in relation to other objects, have been impaired in Chiari malformation. So that is kind of like have always been like a cognitive biomarker, whereas, like language and processing of information and attention has not been as involved, but things have changed and evolved over time. The reason, why cognition has not been researched that extensively was mainly due to some disappointing findings in how cognition, has changed after surgery. Studies have shown that it hasn't changed much. And that was a little bit disappointing because in the study, I'm just pointing to one from 2021, um, it was found that even though, like Chiari patients perform below average in some, visuospatial processing and in some motor skills, unfortunately, after surgery, not much has changed. So while patient had improved in neurological function, the visuospatial and planning and memory scores have not improved, and they were mainly like associated with mood changes. And so the concern was then raised, well, maybe all the brain fog or the cognitive problems that patients, uh, like complain about is more like due to the pain, due to the stressors, with the condition that is so, chronic. And then ultimately, if you don't get answers, you become anxious and depressed. We all know that this is human nature and naturally. So is it more like just all related to the psychological stressors, and that's why you become so stressed out? Of course, and data has supported that, but two things we always forget, and that's what I'm getting at, is that we also know that spinal fluid circulation problems, like intracranial pressure and the spinal fluid, not circulating, is also associated with cognitive problems. And Dr. Zvokos has nicely shown that we should not forget about looking at the obex, the outlet of the fourth ventricle, where we sometimes see all that scarring. And could it be that it's in fact more like a spinal fluid pressure thing that affects cognitive dysfunction and cognitive alterations. And then even the group around Phil Allen from like that had worked a long time with Chiari and Cognition together with Frank Loth, and they worked out of the University of Akron. They appreciated more recently that even though emotional dysregulation and cognitive dysfunction are a matter of chronic pain and depression and anxiety, but there are also indications that it's associated with cerebrospinal fluid flow dynamics and or cerebrocerebellar communication pathways. So that is the important message here. So the concern is there's also something wrong with the cerebellum itself, whether it's going to be like blood flow impairment or ischemia or compression. So it's not just anxiety, panic, depression. There might also be like a cerebellum dysfunction that causes our cognitive decline. And that's what we are researching because it hasn't been researched enough. So what Phil and his group showed is in resting state MRI, which is kind of a very cool MRI. So what you do is you have a patient just chill in the MRI scanner, and then you record the blood flow. And then if blood flow in certain areas by signal changes in the MRI occur simultaneously, you know that these areas are talking to each other. And what the group found is that there is a connection between cerebellar areas and some cortical areas here, the premotor cortex, and they are hyperconnected. But they also found some areas that are not that are connected, but the blood flow is low. So they call it like hypoconnectivity, meaning that these pathways are connected, but the connection is not good enough. There's some deficit. And these actually were connections where the tonsils were involved. So basically, there is dysfunctional connection between some cortical areas and the tonsils. So that means like really the tonsils, that are squished and squeezed and Chiari malformation are connected to higher cortical areas. And that's very intriguing. And that made us to believe, okay, the tonsils or the cerebellum is also involved in cognitive or mental dysregulation in Chiari malformation. And as Dr. Zvokus has shown, and you see it here on the right, is the tonsils are abnormal. They are sick. You see here like this white topping, I always call it, on the tonsil, and we published this a couple of years ago. That is gliosis ischemia, and so the tonsils are abnormal, and they have abnormal dysfunction, and that's why like we started looking at, could it be that the cerebellum and the alteration of the cerebellar structure, let it be ischemia, scarring, stiffness, and excuse me, and compression might be affected. So baseline cerebellar function, could that be explaining a lot of cognitive deficits that we see in Chiari patients? And so what do we need to do? Well, we need to find like tests that are designed to measure, cerebellar cognitive dysfunction. And here I'd like to show that picture of Dr. Schmahmann, who actually also attended a conference that was sponsored by Bobby Jones in 2017 at Brown, um, that had shown, that shows um, how much the cerebellum is involved in cognitive regulation. And the seminal paper from Dr. Schmahmann was, showing that in patients with, cerebellar stroke or hereditary ataxias, which are like cerebellar congenital genetic malformations and other acquired injuries to the cerebellum, those patients had shown tremendous deficits in executive, visuospatial, and affective functions. And he actually mapped out the cognitive profile of the cerebellum. and the cerebellar cognitive map, which was the first of its kind. And then later he came up with the Schmahmann scale, which is a cerebellar, grading scale that grades, like the cognitive affection or cognitive decline from cerebellar injury. Busy slide, but I just want to mention that there are two scales that he designed. It's the cerebellar cognitive, the cerebellar neuropsychiatric rating scale, the CNRS, and we published on this. And what we found, that patients with Chiari have deficits in the psychosis spectrum, social skill set, emotional, and also uh, 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 cognitive affective deficits. And here's the exciting thing. Um, they improved after decompression surgery. And that applies to both adults and children. I told you that initially, when these comprehensive neuropsychiatric tests have been applied, the disappointing result was that they didn't change much after decompression, and people got a little bit, discouraged about cognitive and Chiari and what does it do and how does it help us. But here we have a scale that we applied, and we have shown, that it changes after surgery. You can see here, like a good amount of patients had improved in the cerebellar neuropsychiatric rating scale after surgery. And you can also see here that it applied for both children and adults. So both children and adults had a tremendous amount of improvement in the scale, and it was significant. And the one thing that I want to bring to your attention, which is kind of exciting, is also that there is improvement also in autism spectrum dysfunction measured by that scale, and that is significant. So basically what this is saying, if we measure the cerebellar cognitive dysfunction, we do see changes. So that speaks to the fact that actually the cerebellum is involved in the cognitive modulation in Chiari. We just have to look at it and use the appropriate scales, obviously. So what also is important, that truly measuring the cerebellum is a separate, distinct outcome scale. Um, uh, so our dear friend, Dr. Frim, who passed away a few years, gave us this very important, awesome tool to measure outcome in Chiari, the Chicago Outcome Scale, which measures, like functionality, non-pain, and pain outcome. But what we have shown is, like when we looked at the changes of the cognitive score over the different outcome scores, even people that are still like kind of impaired or have a not so good functional outcome, they still have cognitive improvement after Chiari decompression. So we are really treating like cognition when we do the decompression in Chiari malformation. So that's really important message. Of course, like time goes by, people get more interested, and then Friedlander also published, that there is in fact a cognitive affective problem in Chiari. This is a very nice publication from last year. So thing is, like what Friedlander did not use, they used a bunch of neuropsych tests, but they did not use a cerebellar or cerebellum designed scale. And that's where we come in, I'd like to say, with our cognitive affective syndrome scale, the Schmahmann scale, which I show you here. I cannot go through the details in the interest of time, but it has like, these are the symptoms, that Schmahmann found out are dysfunctional in people with a cerebellar stroke, with cerebellar, hereditary diseases. So this is basically how the cerebellum talks to us, in other words, And so what did we find? So we looked for patients, that we knew we're gonna do surgery on, and then these are the patients, and then they all did the Schmahmann scale, the CCAS scale, and then not all of them underwent surgical decompression, but those are the ones that underwent surgical decompression, and others were just monitored clinically because they were not yet candidates for surgery. But all of them did the Schmahmann scale, and what was really kind of impressive is that almost 50% of Chiari patients had the diagnosis of a definitive or definite cerebellar cognitive affective syndrome. So this is very significant. So Schmahmann said, if you fail one test of the ones that I showed you, you have possible cerebellar cognitive affective syndrome. If you fail two tests, you have probable. But if you fail three tests, you have definitive cerebellar cognitive affective syndrome. So basically, almost half of the patient with Chiari have the same issues like a person that had a cerebellar disease, let it be a cerebellar stroke or other cerebellar issues. And so ultimately that scale might be really relevant for Chiari. And here, really briefly, you can see that the Schmahmann scale or the CCAS scale really significantly correlated with all the standard neuropsych tests with the DCAFs, the Dallas-Kaplan scales, with the Wechsler intelligence scale for both kids and adult, with the wide range achievement tests. So that means like really that scale, the CCAS scale, is a good tool that covers all the cognitive domains and might really be a relevant screening tool. So basically, like what also, and then this is my last slide about the cognition, is what also we can say is, like really um, the cerebellar scale has also correlated with the neurocognitive and neuropsychiatric subjective complaints. So these are all the subjective complaints of our patients. And so the patients, that had like said, I have brain fog, I have some memory problems, I feel moody, I feel distressed. So in those, we did see, like the cognitive affective syndrome scale showed significant correlation with those symptoms, but not with the other symptoms. So this is a cognitive measure. And then when we correlated it with Dr. Frim's Chiari outcome scale, we saw that the CCAS scale mainly correlated with non-headaches, like more like swallowing problems, dizziness, disequilibrium, like the non-ICP related symptoms. So really symptoms, and also with like vertigo, dizziness, so more like with cerebellar symptoms. So basically, like really that speaks to the fact that since the scale is associated with cognitive complaints and the scale measures non-ICP related symptoms. So it's got to be some, structural things that it measures. And here we have the cerebellar dysfunction. So basically, I would say, like really we can say the cerebellum is involved. It's talking, in Chiari, and decompression helps cerebellar function and thereby helps cognition. And that might in the future be actually also an indication for treatment. But let's not go that far. But would we ever decompress someone for just cognitive symptoms? We may. So I know I have 10 more minutes, but thanks to Dr. Sullivan and Dr. Zvokos, you already heard about the myodor bridges. So very interesting also because it might give us a little bit more mechanistic evidence of like the oops, sorry about that, about like biodynamics in Chiari. So these myodor bridges are ligaments that connect the suboccipital muscles to the dura, and they're supposed to tent up our dura. So when we move our head, it makes sure that the dura is not collapsing. And actually, a Chinese group said, like actually, yeah, that's good. So when we move our head, we really get our fluid going at the base of the skull. But what is this for Chiari? So in 2022, I was part of the team that published, like some speculations about the role of the myodor bridges in Chiari. But now we're not longer want to speculate about it. We also started research on that. So the speculation was that maybe the instability that Dr. Sullivan was mentioning and some trauma. We know sometimes whiplash injury can tick off the Chiari symptoms, or like getting a blow to the head. Um, maybe that causes mechanical stress to the myodor bridges, to the ligaments, and then they become inflamed, and then they become stiff. And when they become stiff, they stiffen the dura. And that is also part of the problem, where the spinal fluid is not circulating as much because head and neck movements now cannot cause pumping of the CSF, and that increases the intracranial pressure and causes strain and problems to the tissues, and then ultimately also Chiari symptoms. So basically what I'm saying is that could it be that the myelin bridges add to the stiffness and the tightness of the skull base in Chiari? We found that with the ultrasound, you actually can, like image these myelin bridges. We published, an ultrasound technique, bear with me, where you can actually see how the myelin bridges dock onto the dura. This is like a ultrasound. This is the dura below the base of the skull. That's the spinal cord. And here you see the muscle, the bridges, and then these white things are the connective tissue bridges. So here's where the muscle connects to the dura through the connective tissue bridges. And we have shown that when you extend your head, as the bridges are supposed to do, they kind of pull on the dura, like here, and you widen your spinal fluid space between the dura and the spinal cord. So head extension improves our cerebrospinal fluid flow. So we should do it more often during the day. But what is relevant here to the disease? We actually, looked at patients with connective tissue disorder to see can these ligaments fail, and what does it do to the spinal fluid circulation. And we published that in patients with connective tissue disorder, the myelin bridges don't do such a great job. You see here a healthy person, the widening of the CSF space, as I told you. And here you see in a person with a connective tissue disorder, in extension, the dura doesn't do anything. In fact, it looks like it's more compressed. The spinal fluid space is less, like widened compared to the neutral position. So we found an ultrasound technique where we can actually see and monitor the function of the myelin bridges. So now we can look at them. But real quick, I have to throw in 2 slides here where we show that actually, we know, how the myelin bridges can fail. When we did Chiari surgery for people with connective tissue disorders, we looked at the specimen. Here you see the myelin bridges as a specimen. You see the muscles here. You see the dura here. And then you can see here how the connective tissue connects the muscle to the dura. So now you believe me that this is really like a connective tissue that attaches muscle force to the dura, and that's how it all happens. But what happens, in people with connective tissue disorder, here, 8 of them, since the connective tissue or the collagen, which is the hallmark of the connective tissue, is dysfunctional, like swollen, corkscrewed, which is really like speaks to a pathological, um, transition of the collagen fibrils compared to a healthy collagen bundle, as you can see here, all nicely aligned. That's, like probably where the myelin bridges really fail. And so is that also happening in Chiari? And so we rarely appreciate, how often we actually, that how we deal with the myelin bridges in Chiari surgery. So Dr. Zvokos talked you through the steps that we have, like when we do Chiari surgery, and the tissue that we always kind of like dissect because it's in our way in order to get to the skull base, in order to decompress, is the myelin bridges. So we have been not so, aware of, like the myelin bridges. And I'm showing, like, I don't know whether the video plays, but before we open the dura, we have the myelin bridges kind of right there. And like we always remove them because they are in our way before we open the dura. And I'm pulling there on those, and you can see that they really kind of move the dura there. I hope you can see that. And so they are, in fact, like bridges, connective bridges that are moving the dura. So you see the proof right here. And you can also see, like I had a patient recently where the myelin ridges were so thickened and stiff, and after I removed them, we were kind of did some ultrasonography on the dura, and you can see here, like I'm pushing a little bit on the dura, and you can see how stiff the dura is, like here is the dura over the cerebellum, but you can see here that dura doesn't move at all. So really shows like how the myelin ridges have stiffened the dura, and so kind of some mechanistic proof, that they are a problem. So just showing you that. So now we are removing the myelin bridges, and we're sending them to Frank Loth from Northeastern University, and we're doing some stress and strain testing on the myelin bridges. You can see them here removed. As I said, we remove them naturally. So now we're just asking the person, hey, can we just take your myelin bridges and send them to the Northeastern bioaxial testing device lab, and we want to prove that really your myelin bridges have gotten stiffer and have, like altered the dural integrity. So we're doing like some stress and strain tests to see, are they stiff? Are they not doing their job anymore? For the last slide, I just want to show you that we're now doing on people that are supposed to have Chiari surgery. We're doing this duplex ultrasound, and we can actually, again show, as I told you. So the duplex ultrasound is much more detailed. It can actually really show. You can see here the muscles. These are the suboccipital muscles, and then you see how they connect to the dura here through these, white connective tissue bands. So we can see the myelin bridges way better. You can see here inflection, how the myelin bridge here, is connected to the dura. In extension, as I told you earlier, it widens, the dura as it's supposed to do, And then we now also doing Valsalva maneuvers and coughing because we want to see, is there a difference in like how the dura, expands between Chiari and not Chiari patients. And you can see here that this is, just kind of a cough, you're coughing, and you see how the myelin bridges, all tug on the dura, you can see here like a Valsalva maneuver, where when you push, see the patient is doing Valsalva, and you see the dura widens here, because you kind of, like, so the myelin bridges and the dura are one element, in Valsalva, of course, causes them to, uh, like expand or inflate and deflate. So there is really a dynamic going on there. And then here we have a Chiari patient, and maybe you can appreciate, that it seems like everything is kind of a little stiffer here. And then here in coughing, it doesn't seem that the dura is moving much. Everything looks like a little stiffer here, And then in Valsalva, like really, so the patient is trying, is blowing the nose, but compared to the control patient, the dura is not doing anything at all. So it really seems like that the dura is stiffer. It almost looks like when you do Valsalva, you are moving the dura more inwards than outwards. So it seems like the connective tissue problem with the myelin bridges is also part of the, or a partner in crime in Chiari. Thanks to the team, we are also now really looking at how the dura moves with the heartbeat. We can track the dural motion over time with the heartbeat. Every heartbeat moves the dura. So now we can compare Chiari versus not Chiari and see, is there really like also a dural connective tissue problem that is partner in crime, which means like that really like removing the myelin bridges might be an important part of the Chiari decompression in itself, So anyway, I think I'm want to just say that we are working hard on non-invasive validation of the disease, of the problem, maybe, the dural compliance and the Craniocervical soft tissue compliance is a novel preoperative biomarker that helps selection. Besides Drs. Vogus and Dr. Sullivan, you already saw on the talks, I want to acknowledge our research team, Owen, May, Amanda, our residents, Natalie and Belinda, who became very interested in Chiari, Leila, who did her undergrad thesis in Chiari and cognition, and Dr. Trask, our neuropsychologist, and a lot of you know Phil Allen from University of Akron, neuropsychology, and Frank of Northeastern Biodynamics Lab. Thank you so much.